fellow behind the mayor, feel free to get in there.
Good afternoon.
Good afternoon.
Uh, Glad to see everyone on this chilly day, but an incredibly important day. Months ago, I said that we could see the end of COVID-19 on the horizon, but only if we mask up to stop the spread and get vaccinated to protect our families and our communities from serious illness. I've spoken often about losing my last living uncle to COVID-19 in a nursing home. No family should go through that kind of heartbreak. And getting vaccinated is the best way to avoid serious illness, stay out of the hospital, and keep our families and communities safe. That's why I got vaccinated right away when I could. And this morning, I got my booster. St. Louis was one of the first major cities in the Midwest to implement a vaccination order for city employees to protect all of our residents against the virus. I'm happy to report that more than 75% of city workers have gotten vaccinated, and we continue to work to get those numbers up, and as the rest face weekly testing. I also made sure that my 14-year-old son, Aiden, got vaccinated too, so he can keep enjoying in-person learning with his friends and teachers. I feel better knowing that he's protected from COVID-19, and he plays basketball. So getting vaccinated helps him so he can stay on the court, which is his favorite place to be, and continue to do the things that he loves. Vaccination is safe and effective. Vaccines save lives. Now, with approval from multiple agencies after an extensive study and review, the Pfizer vaccine has been made available for 5 to 11-year-old children. I understand firsthand how devastating it can be when kids are sent home due to COVID-19 outbreaks. And I recognize how important it is to keep our schools open, safe, and healthy. And as the holiday season approaches, we want to be able to gather safely with our families without fear of spreading the virus and serious illness. Pediatric vaccination is the key to protecting our babies, protecting our schools, and protecting our communities. As a mother, as a niece, as a sister, and an elected leader, I strongly urge every family to get their eligible children vaccinated against COVID-19. We have to vaccinate kids to keep them learning in person instead of virtually, so they can play sports, go to school events, and do the things that they love. Do it to protect our grandmas and grandpas, our abuelas and our papis, our aunties and uncles, and all of our loved ones this holiday season. Make sure your eligible family members are vaccinated to protect our schools, our city, and our loved ones against this virus. Together, we can make sure the rest of the school year is the very best it can be, and our holiday season is healthy and safe. I want to thank St. Louis Public Schools Superintendent Dr. Kelvin Adams for his leadership in holding vaccination clinics for students throughout the school year, and now hosting upcoming vaccine clinics for children aged 5 to 11. We're here in front of Gateway Elementary, which will host a vaccine clinic for children on November 13th and again on December 4th. It's this kind of community engagement that's important to making sure that their children and families are connected to vaccines. Now I want to turn it over to Dr. Mati Slashwayo Davis, who can walk through how the city is using its partnerships with our health systems and schools and federally qualified health centers to make sure kids and their families get protected against COVID-19. We know getting kids vaccinated will be different than past efforts. We're hoping that this community-centered approach, different than previous vaccination pushes for adults, will meet kids where they are and in comfortable environments for them. Dr. Mati?
Thank you. Good morning, everybody. So good afternoon, first of all. So the recent authorization of the Pfizer COVID vaccine for children 5 to 11 is something we've all been looking forward to, and it's finally here. I'd like to start by emphasizing that COVID-19 vaccines are our most effective tool in preventing severe complications, hospitalizations, and deaths from COVID-19. and SARS-CoV-2, the virus that causes COVID-19. Although the vaccine was developed rapidly, all steps have been taken to ensure that it is safe, that it is effective. The City of St. Louis will be implementing a community-based approach to COVID-19 vaccinations for children aged 5 to 11. This approach will ensure citywide access to the vaccine and ensure that parents and caregivers have the opportunity to take their children to healthcare providers with whom they feel comfortable. We will be networking with trusted community messengers, schools, community-based partners, healthcare providers, and members from the general public to make sure we have an equitable approach to our vaccine efforts. Our plan has 4 major components. First, the identification of vaccination partners in our community to leverage existing trust and relationships to provide COVID-19 vaccines to children aged 5 to 11. These partners will include Affinia Healthcare, Care STL Health, Betty Jean Kerr People's Health Center, BJC Healthcare, SSM Health, SLPS, charter schools, and independent schools, amongst others. Number 2, supporting vaccination clinics sponsored by our partner agencies. So this will include coordination of clinic and non-clinical support staff, vaccination supplies, document production for EUA sheets and vSafe flyers and clinic advertising, as well as vaccine education messaging. Number 3, monitoring the pediatric rollout and identifying any necessary adjustments. And finally, identifying gaps that could impact clinics led by the Department of Health. I also want to take the opportunity to remind the public that even though the vaccine is now available to those aged 5 to 11 until vaccination levels increase, we still need to continue practicing those mitigation measures we've been using, such as wearing face coverings when indoors, around persons not in our household, social distancing, and having events outdoors, all things we know can prevent the spread of the virus. Listen, folks, this is personal for me. I have a baby that turns 5 in November. I gave birth to a baby in May of last year. There's nothing scarier for a parent than not having every tool available to protect your kids. Honestly, I may weep when I take my child in November when it's her turn. This is very personal for me, very personal for all of us here. I'd like to close by saying that increasing access to healthcare for our residents is a primary focus for the Department of Health. It's one of the essential services of public health. Our community-based approach to getting these children aged 5 to 11 COVID-19 vaccination will also help ensure that they have opportunities to find healthcare homes. This can't be a one-stop shop, right? This is one area our FQHCs and hospital systems will be assisting. Finding healthcare homes for children and families who currently do not have one will provide major benefits to families behind COVID-19. Thank you so much.
Good evening, and I want to thank the Mayor and Dr. Davis both for being here as we have this conversation about what's going to happen as it relates to our students. 9,190. That's the number of students who became eligible yesterday for a vaccination in the St. Louis Public School District. Over 3,000 students have been quarantined as a result of contact tracing by being exposed to a student or a teacher who likely had the virus. This is a game changer for public education because it gives us an opportunity to keep students in the classroom. The partnership with the city, the partnership with Dr. Davis is incredibly important. As you've already heard, on the 13th of this month, in this building, we will start the process of actually putting shots in arms for every single student in the St. Louis Public School District who wants to have the shot. I think the doctor has made it really clear that this is an important, life-changing time for students. They have not had the opportunity for that to occur prior to this time. And so I'm incredibly excited that the city has always been a partner with us, and under Dr. Echols' leadership and now under Dr. Davis' leadership, have been real partners in terms of working with us as we work with the details that have to take place as we determine how best to provide education to students who are in the classroom every single day in the context of a pandemic and a virus. And so I just want to say to our partners behind me, thank you very much for making this a priority for students. I want to thank the health agencies as well, who have always partnered with us to try to make sure that we're doing everything in our power to give students an opportunity to be successful in the classroom, and that only occurs if they are present every single day. The American Federation of Teachers, to my right, have been a real strong partner in making sure that all of our staff, at this point in time, 97% of our staff have been vaccinated, 97% as of October the 15th. And so teachers are leaning in every single day to try to make sure that students are being given the best opportunity to be successful. And so I just want to say thank you to the mayor and thank you to Dr. Davis for their partnership. She started last week and she contacted me as early as yesterday for this conversation to take place, making young people a priority in this effort around the vaccinations. And so November the 13th, in this particular building will be the first day, and December the 4th. Students will have to come with their parents. We will give them an opportunity to fill out a DocuSign online such that they can have the ability to do it virtually in terms of signing, and then they would have to show up here from 9 until 12 for the vaccinations to start. Again, I want to say thank you for being here, but more importantly, thank you for the support that we're getting as it relates to making sure that students get an opportunity to be vaccinated and therefore not have to quarantine and therefore not have to miss school days, and more importantly, not be in danger of being sick as a result of the pandemic and the virus. Thank you very much.
I'm Byron Clemens with the American Federation of Teachers, St. Louis. I want to thank the good doctor, the mayor, and Superintendent Adams. This is an exciting time for our employees in the St. Louis Public Schools. This is looking towards a new normal. You know, we're looking towards these layers of protection so that someday soon a sports team might be able to play, if everybody's been vaccinated, without wearing masks. We're looking forward to that. Seeing grandma safely, we're looking forward to that. So I'm proud to say that our national union has extended a grant for us to continue to do our outreach with the city health department, the community, and the St. Louis Public Schools. So we'll be phone banking, knocking on doors, trying to get the community to turn out. But this is great news. Thank you to our partners.
All right, we'll open it up for questions. We got time for about 4 or 5. Go on ahead.
What else is the city doing? I mean, outside the school system, is the health department going to run clinics? What other opportunities will there be?
So the plan that we've rolled out has two main themes. The first is education, and the second is the actual access and rollout. So for the education portion, it's important that we provide information. I mean, this happened fast, guys. You know, people haven't even had time to digest what data was available. And I'll tell you, as a mom of 5, my husband's a pediatrician, I'm the mom that picks apart everything. Do you understand me? Like, you're not gonna put a shot in my baby's arm without me knowing what the side effect profile is, and what data actually went through to determine this. I'm also an infectious disease doc and public health expert, so I know how to evaluate that data, right? So it's my job to make sure that we break that down in a way that's accessible for parents. As early as today, you can start coming to our website to access educational resources, and we'll be updating those. But the beauty of the plan that we put together is we're putting forth accountability throughout this process. So one of the things that I'll be doing is convening a work group of 15 to 20 people that represent all the silos of stakeholders, our schools, our healthcare providers, our clergy advisory board, our board of aldermen, my staff, the general public, the mayor's office, meeting bi-weekly to give feedback on what's working and what's not. We also have an incredibly talented epidemiology division who provide timely and specific statistics around COVID-19. You'll be seeing those on our website as well in ways that you can manage the information. We have to respond to data. I always say data is justice. Data drives policy, right? So we have to start with, where are the needs? What do we know right now? Well, we know that the African American community is shouldering 76% of COVID-19 cases in the city, right? So I need to be looking at zip code level data to say, where do we need to be going to provide clinics, and then coming with my partners to providing clinical services and wraparound services, right? Also, we need to have community access to being able to have a dialogue. So you'll be hearing from me shortly about a summit for our stakeholders, the teachers, the schools, and the healthcare systems, and then a town hall for parents to come. But then even though I'm 2 weeks in, guys, I gotta earn this check, right? So I've gotta be making myself available to the schools and our partners and show up for webinars. I'm doing a Facebook Live. I'm talking at the kids' daycare next week. You know what I'm saying? Could be 5 people show up. Sometimes it'll be a couple of hundred. But that's the job. That's what I did this for. That's the passion, right? And so, but the crux of this that I want to make clear is I had to remove the need for us to say that we're doing everything, right? We do not do a good job. There's a lot of this that's great because we don't have to reinvent the wheel. But what is very specialized about this population is I can't ask parents to bring their 5-year-old kids to the dreary, drab health department building downtown. I had a vaccination event last week at a Metro transit stop. We ain't bringing kids there, right? So we need to, what we know from national data and those of us who work in this field, right? I do a lot of work around equity. I'm an infectious disease specialist. And what we know is that kids need to be where they're comfortable. Where are they comfortable? Their schools. That's why that was a priority for my partnership. Where else are they comfortable? At their primary care physicians or healthcare providers. That's why they're a main partner. But lastly, this is where marginalized communities get left behind. They don't always have a PCP or the ability to be at school reliably. So I had to bring in, and these are the leaders in our partnership, are the FQHCs and our community leaders, so that we bring vaccinations to where kids are most comfortable. Does that answer your question? Okay, great.
This one's for Dr. Adams. What's the process for teachers who didn't meet that vaccination deadline? Are they terminated? Are they suspended? And how many people specifically, fall in that category?
At this point in time, as of October the 15th, there were approximately 136 personnel who were given options to either resign or be terminated as a result of them not complying with the vaccination mandate. Based upon the tenure of the employee, hearings are required for some of those employees, but at this point in time, 136, 46 of which were teachers.
And they're terminated, correct?
Some persons had the options for hearings that have to take place over the next 30 days.
Okay. Dr. Adams, you're not requiring this. We have a vaccine now that's available to 5-year-old children on up. So pretty much every student you see has access to the vaccine. They're not going to be mandated.
Vaccines are not mandated for any student at this point in time.
But for the staff, they are.
Yes, sir, that is correct.
Now, does that seem fair? And maybe this goes to the health department too. And is it particularly effective if you only have one segment of your population in your district
I'll let the
where
health
this
experts.
mandate is in effect? But I mean, should it apply to everybody? Why single out the staff as opposed to just the students now that it's available for everybody?
It is my understanding there are mandated immunizations that have to take place, and this is not one from the state of Missouri, and so it's not mandated for that particular reason.
Well,
So-
the state of Missouri doesn't have a mandate for employees,
A mandate for children in terms of vaccinations.
but the school district has it for the staff.
That is staff, not students. You asked a question.
No,
about-
I understand that,
Okay.
but I mean, shouldn't it be a blanket? In order to get the maximum effectiveness, now that's available for kids, why just require it for the staff and not the children? It doesn't seem to make a whole lot of sense if you're not gonna put it across the board.
At this point in time, it's only for staff.
I understand.
Yes, sir.
Should it be that way?
Normally, when vaccines are mandated, they are mandated from the state of Missouri based on some requirements, and this one is not mandated for students at this point in time by the state. Smallpox, chickenpox, all of those kinds are mandated. This one is not. So we're taking guidelines from the state as it relates to that.
But the state's not mandating for school district employees.
That is correct.
The school district is doing it.
For staff, that is correct.
Correct.
That is correct. Because we have the flexibility to do so, we made a decision that we wanted we felt it was the best way to protect students. The vaccine wasn't mandated for students 5 through 11 until as of 2 days ago, and so we thought the best way to do it is to make sure that all staff would be vaccinated.
Should there be a mandate for students now that it's accessible?
So the city health department doesn't control the mandates. We're not responsible for those. I'm sorry. I'm a rookie, guys. Work with me. I'm a learn. So the city health department does not control, the individual mandates for the school. What I will say is, it's difficult, guys. This is a hard thing. Policy it takes a while for it to translate. So I think what I'm hearing from here, and I can't speak on his behalf, is that before we had the ability to vaccinate more people, we dealt with what we could have. And honestly, we should be protecting our kids first, right? We should be protecting the most vulnerable. As a doctor, I'm required to do this. When I come into the hospital every year, I have a slew of vaccines I have to take because I have at-risk populations. But unfortunately, I can't speak on behalf of the school districts because that is not something that I personally mandate at this time.
What percentage of students do you want to see vaccinated so you can reach herd immunity?
Science question. I get so excited. I'm a nerd, guys. Just roll with me. You're going to see so much more of this. Herd immunity is the goal, guys. God, we were talking herd immunity like March of last year, and we're almost 2 years in. So let me just say first, I really empathize with the community. We should not be 2 years in and still dealing with this, and the goal is herd immunity. So the problem with that is it's a moving number. Sometimes you'll Google and you'll see people say 70%, 60%, but that's not accurate, right? You need to be looking at so many other epidemiologic factors at the time, and so we can give estimates, but we're always looking at what's happening at a national level. And then unfortunately, we have 50 states. I was born in a little country the size of Arizona. That's really easy to come up with one number for. You can't do that as easily with 50 different states with different case positivity rates and different vaccination rates. So what we will do is look at how we're doing with the case positivity rate, how we're doing with vaccinations in general, and work with our epidemiologic partners led by the City of Health to make sure that we've reached a number that makes sense for herd immunity. That is the goal. It'll make our new normal way better.
Well, we got time for one more.
This might be for you or Dr. Adams again. What are you guys, SLPS, doing specifically for students? Is there like a schedule of vaccination clinics that you guys plan on rolling out? Is there something in the works? I know another school district said every Saturday in November they're going to have something out of school. Kind of, what's it going to look like for parents to know that the accessibility?
It's me again. So the joy of this partnership is I want to make this as easy as possible for parents and kids to be able to figure out what their options are. So what I came to my partners and said is, please let us take the lead on communications so that there's a central place that parents can go to see what's going on. So as early as today, if you go to the City Department of Health's website, you can see a schedule available for where you can go and at what time. We'll be updating it as much as we can. Bear with us because sometimes last minute cancellations happen, but that's where you'll be able to get that. And what's wonderful is our partners have been so gracious in saying that they'll be providing us with their schedules. We'll be communicating with them. That work group I told you about will be giving feedback. So it's really going to be something that we focus on to make it as easy and accessible for everybody.
All right, thank you all very much. Appreciate you coming out today.
Thank you.
I don't know. In front of the sign?